Hey everybody, this is Dr. Terrence Myckatyn, and I'm doing a Facebook Live today specifically on neck lift. So this is part of our facial aesthetic surgery series, and let's talk about the neck a little bit. So we have a couple questions that have been sort of previously sent to us, so I'll try to address those first. So the first question is, who is a candidate for a neck lift? And so basically, when we're looking at the neck and we're trying to sort of make decisions regarding improving the contour, there are several factors. So, one of them is going to be the skeleton. So, meaning the cartilages of your windpipe, the thyroid gland, the hyoid bone, and then your jawline and your chin. And so, what makes a nice neck aesthetically is going to be one that has nice definition, meaning that there's a nice acute angle to the neck. So making sure that we address the skeletal part of that is important. And there's certain things we can and can't do with that. What we can sometimes do is lengthen the jaw to by increasing that length, we can make the angle more acute. And so we talked about this a couple weeks ago, but you can do chin implants or jaw distraction or lengthening procedures in order to increase that vector to improve that angle. So short of that, then the next thing is going to be the soft tissues underneath the skin. So between the bones and the cartilages and the skin. So what are those? So those are a couple things. One of those is going to be the fat. And so that's sort of this double chin or this excess fatty tissue that exists below the skin level and also underneath one of the muscles called the platysma muscle. And so that fat can be removed in several ways. There's a product called Kybella, which many of you may have heard of, which is a version of something called lipodissolve, which is essentially a chemical that can be injected into the fat. And over the course of a month, it can help to dissolve, causes inflammation, and then eventually the removal of deposition of fatty tissue under the chin. That is often repeated 3 or 4 times to get a better effect, and that can remove some of the fatty tissue. There's also something called Coolsculpting, and Coolsculpting is essentially also called cryolipolysis or freezing the fat. And this is because our fat cells are more sensitive to cold temperatures, and essentially cold will eventually cause those fat cells to die. And then our immune system clears out those fat cells, causing a reduction in the amount of fat under the chin. And then there can be liposuction, where we just do surgical liposuction to remove that fatty tissue. The other soft tissue in the neck is, and you can see on these muscles here, these are called your platysma muscles. They form like a corset around your neck. It's a flat muscle. In many of us, we have a gap between the edges of this muscle, and they create bands. Those bands can be softened by injection of Botox, and those bands can be also addressed surgically. They can be cut in surgery, or they can be sewn together to create a tightening effect underneath the neck as well. And that's part of often of a surgical facelift as well. And then, of course, the final thing is the skin. So we got the skeletal structure, we got the fat in the muscle, and then we have the skin. And so the skin redrapes over all these structures. From a non-surgical perspective, there is a therapy which is called Ultherapy, or it's an ultrasonic assisted therapy, where essentially we use sound waves or ultrasound waves, which is a type of energy, to create heat and heat the collagen layers underneath the skin. Our skin has collagen, which is a type of protein in it. And by heating that, it can create a tightening. So Ultherapy works to tighten some of that collagen and creates a nice tightening effect that can tighten the jawline and the skin and other areas. But it can be used in the neck, and it creates some mild improvements in those contours in a lot of people. One thing I didn't mention, but is sometimes also done, is we have salivary glands, which create a saliva or spit. In some individuals, those salivary glands can be prominent. There's something called the submandibular gland, which can be prominent. There can also be the parotid gland. So sometimes the submandibular gland can also be trimmed in order to create a flatter appearance and a more angular appearance to the jawline and improve the contour of the neck. So that's another thing to consider as well. So who is a candidate for a neck lift? So first thing we're going to do is we're going to try to figure out, is that patient somebody who has too much skin? Is it that there's not enough bony projection of their chin and their jaw? Is it that they have too much fat? So different treatments for different issues. So if somebody comes in and they have too much extra fatty tissue, and they're looking for a non-surgical alternative, then we'll probably try something like Kybella or Coolsculpting. Now, if that patient wants maybe a quicker fix, or maybe they have more fatty tissue than we feel like the Coolsculpting or the Kybella can address, then we can do liposuction on that chin. And that can be done either in conjunction with other facial cosmetic procedures, or as an isolated procedure even in the office under local anesthetic. Now, if somebody comes in and they have quite a bit of loose skin, if it's a mild amount, then that person can be addressed with the Ultherapy device, as we discussed before, to tighten the skin in a non-invasive way. However, if that individual has either a combination of fatty tissue and skin or bone, or they want a more sort of a long-term and maybe a more substantial result, then we'll consider doing surgery for that person. So a neck lift